There we go. So I'm going to turn this over to Dr. Kelly Clifton, our Associate Vice President for Research, and let her talk with you about these research operation levels. Can you go back one slide, Sean, to the research operation levels? Thank you. Because these are new, and I think it's important that we all think about these first. So Kelly?
Great, thanks, Jason. So first I want to say good morning, everyone, and I just echo Jason's well wishes to everyone, and thank you for joining us. We look forward to answering your questions and also getting your feedback. So as Jason said, we've all been working hard to think about how we can support you and your research and think about the opportunities to return to having some research activities on campus, and that's going to be something that we all have to do together. And I think this is probably the first of many times you're going to see and have the opportunity to converse with us about this. So these are new, as Jason said. They were developed specifically because of COVID, but we're hoping that these have use beyond this, although we're not hoping that we have other emergencies like this. And so, as Jason said, we are aligning these operation levels with OHSU for the reasons that he iterated, and it's the first time you've probably seen them. So currently we are operating at level 3, more or less. So I think that's something that we're going to need to start communicating, is what level of operations that we are at. And the other thing to note is that as we are thinking about how we might resume research activities, just know that our movement along this scale is bidirectional. So as the response to COVID changes, if we see an uptick in the epidemic, we may move back and forth across these levels as conditions change. So it's meant to be responsive. So that's just to give you a sense of like where we are. These are different levels of restrictions of activities. And I think we have a link to this in the guiding principles document. It's at the end, and there should also be a link to it perhaps in the chat at some point. And we have these aligned with different types of research activities and more descriptions in that document if you want to take a look and give us some feedback and comment. The other thing that I'm going to talk about is about the process, which I know you guys are all very interested in, the process for which we think about restarting research. So Sean, if you could advance to the next slide. Great, thanks. So we have developed a 5-stage process, and we've been working with others, the incident management team, environmental health and safety, and others on campus. And today we are working with you. We're here to get your feedback and thoughts about this process. And so today the majority of our time today is going to be talking about where we are, which is at stage 1, which is thinking about our guiding principles. So what are the values we're going to use to guide our decision making as we navigate this process? The second stage will be about evaluating our capacity. So what are the conditions on campus? What is the capacity for us to safely resume research activities on campus? And that's going to have different effects on different buildings and different labs, but we need to do this kind of evaluation. The third piece is going to be about developing plans, and the plans that are developed are going to come from you. So you, in coordination with your chairs and deans, to figure out what the priorities are, using, of course, the guidelines and the capacity that we have to restart operations. So that's something that's going to happen at the unit level. And then the next stage is going to be some sort of review on stage 4, an approval process. And what we're going to have to do is then think about how we coordinate and integrate these plans across campus, because we share facilities. And I think that's going to be a critical component. And then stage 5, which everyone is anxious to think about, is the implementation. So just to say that we are also have been working to develop several tools and training that we're going to share with you shortly. And that's supposed to help you in the development of plans. And then we're all going to be required to have some sort of training before we come back to campus. So that's another thing that we've been working on. So today we are really focused on what our values are and making sure that we are thinking through putting safety first. So Jason's going to talk about this, and then you're going to have some time later for questions and comments. So Jason, back to you.
Thanks, Kelly. Sean, can you go to the next slide? Okay. So today, what we really want to talk about is it's an exercise essentially in prioritization. And I think it takes a little bit of thought to think about what is urgent and we really feel that things that are urgent need to receive priority. And I just want everyone to know that I don't think that urgent is not a measure of importance, that everyone's work is important. And I know everyone wants to get back to research as soon as possible. But as you can see from the plan that we have, there's these percentages of work that we feel like we're going to be able to support on campus. And that means we can't just go from closed to open. We need to slowly reopen so that we can make sure that we can respond quickly if we need to start shutting things down again. So this is really about managing how we occupy space and also with some considerations for air quality and, you know, disinfecting and stuff like that. But it's really a matter of making sure that we can keep people separated from each other. The principles that we're talking about today have been developed in cooperation with research offices across the country through the APLU, that's the American Council of Public and Land-Grant Institutions, and specifically the Council on Research, which is the research offices from all of those institutions. And they're really meant to guide our decisions and help us to prioritize the limited work that will resume on campus at first, and to help us develop our phased plans for how we might reopen research. The reason I thought that it was so important for us to start here is that we really must all accept and respect these basic principles in order for the community to work effectively together in the following months. So I think at this point, I'll just go through the 7 principles really briefly and give a little bit more context to them, and then we can open it up for questions and discussion. The first principle is pretty obvious. We have to follow the directives of the local, state, and national public health authorities. So for Oregon, that means there are basically 2 executive orders that apply to us. There's the statewide stay home executive order, but there's also an executive order that's specific to higher ed, which is set to expire sometime around June 13th. And so, but as you've seen with all the other executive orders, they keep getting extended. So we're not quite sure what that's going to look like. And then the other thing to think about is that we have very clear requirements at the county level for how to reopen parts of Oregon. So Multnomah County will have to reach certain landmarks in their ability to respond to COVID infections before we can move forward. So we're tied, whether we like it or not, to Multnomah County Public Health. The second guiding principle is to protect the health and safety of the research workforce and our human research subjects. I think this one doesn't really need much explanation. That should really be our number, one of our highest priorities in this is to make sure that we are doing this in as safe and as low a risk way as possible. The third principle, and this one I know is a bit controversial for some, is that undergraduates are students first and researchers second. And I think it's very important, and we offer students with research and creative works experiences invaluable experience when they join us in the lab or in the studio and work closely with us. But I think, at least for me, I sometimes forget the power that they perceive that we have. And sometimes what is meant to be an offer of support or the offer of an opportunity to come back can be interpreted as an order or a mandate. And we want to make sure that those people that are vulnerable and don't feel safe coming back are not forced to come back. That's really important, that people can self-regulate when they need and are able to come back to campus. This doesn't mean, of course, that no undergraduates are going to be allowed in research operations, but it means we should be paying extra close attention and be extra critical of whether or not their role is in their best interest. Guiding principle number 4, protect the career of early stage researchers. So without a doubt, this pandemic is going to have the largest effect on early career stage researchers, grad students, postdocs, early stage faculty, especially in those graduate students that are nearing completion of their degree. We don't want to hold them up and delay their whole career trajectory by a year or more. Same for postdocs and pre-tenure faculty. Now, I think that this is a really important thing to stress, but does it mean that that's the only work that can go back on campus? No, right? We've got unit level decisions that need to be made. Everyone can decide how to best weigh those. If it comes to our office to help work out conflicts, we'll probably end up favoring the early career stage researchers over others. And that kind of gets into to principle number 5, to try and implement as fair, equitable, and transparent a process for granting access as we can. We feel very strongly as an office that it's the units and the individual PIs that have to develop these plans. You guys are the ones with the knowledge of what's most critical, whose progression through their degree is most critical. But these, there's going to be many competing interests across campus. We can't support everybody on campus at one time. So we're going to have to coordinate and work together to develop plans. And those plans are going to need to be reviewed and approved only because we need to know at a global scale what's going on across campus, so we know if we have to move back and forwards between the research operation levels, where we're at, who to contact, and what sorts of things we might need to be paying attention to. This is not meant to say that research and graduate studies does not want to be the gatekeeper here. We want to guide and help and add support. Number 6 is to ensure as rapid a research start as public health conditions permit. I know everyone is itching to get back into their lab or their studio and get their research or creative work started again. I feel the same way. I have a student who's got a job lined up in August, and he needs to get his degree. So I understand the pressures, but we have to balance that pressure that we feel to get back into the lab with the safety of everyone in our community. And then finally, the last principle is really to participate in finding cures, preventions, and dealing with the social and economic impacts of this pandemic. This is likely to be a very defining event in our lifetimes and in probably this century, I would guess. And while the pandemic itself, and maybe will only last a year or two, depending on the development of therapeutics or a vaccine, the economic, social, and psychological impacts of this are going to be felt for lifetime. So I think we need to think about that. And I think there's a great amount of expertise at Portland State that could be focused on dealing with those issues. And I look forward to hearing from you all on that. Okay, that is definitely enough of me talking. I haven't been looking at the chat, so I don't know if anybody's asked any questions at this point. So please feel free to ask your questions that you might have in the chat. And at this point, I'm going to go through the questions that you guys submitted beforehand and start reading through them. I'm going to start with the questions there. You guys were, thank you so much for all the feedback, first off. There was a lot of really great stuff in your feedback. And so I'm not sure if I can go through all the feedback, but there are some people that have very specific questions, and I'll start to work through those too. Let's see here. So, well, here's one that came up in the chat. Alex Ruzica asks, can units develop plans now? So you can start thinking about what your, and then somebody else asked, what's a unit? A unit would be, I don't know, a department, a center, a college, it depends. You know, we have different structures for different colleges at the university, and whatever your operational unit is would be the most important one. The way that we envision this happening is that you're going to work as a PI to, or a creative worker to develop your plan. That plan will be developed with in collaboration with the other people in your unit. So your fellow faculty members, your chair will hopefully help to do this. We'll be providing you with a spreadsheet to fill out all the relevant information. And then those are going to be looked over, and there's going to be input from deans, and then those plans will come to RGS at some point. Now, the most important thing there is that we can't really depend on departments. We can't allow departments to have their plans independent of other departments because we share buildings. So what's likely going to happen is we're going to have to work together to do building specific plans, because again, it's really space that we're trying to deal with here and access to space. So that's going to be an iterative process, I'm sure. And so we will, you know, have to work together and be flexible. This is new territory for all of us. Here's another one from Catherine Kahn. Where would the needs of the sponsor weigh in terms of urgency and priority? Well, I think that's something that is, unfortunately, there's no easy answer to that. It's going to be a case-by-case basis, in my opinion. Some agencies have been very flexible, and others have been completely inflexible. And so I think that's something that you guys are going to have to weigh within your groups or units, or about, you know, if some work is really critical and a sponsor is being completely inflexible, that might bump that work up on the priority list. So I think that's the best answer I can give to that. I know it's not a very good one. So there's that. Let's see. I'm going to go to some of the questions that you guys submitted now. So Suresh Singh wrote in, will there be a limit on the number of people allowed in some areas at any given time? Yes, there's definitely going to be a limit to the number of people that can be allowed in spaces. We're working with the incident management team and with the environmental health and safety to figure this out. Most importantly, we need to keep people, you know, it's separated in common areas, and it's really not the labs or the offices that are a problem. That we can keep density down reasonably easily, but you want to also minimize the number of chance encounters that you're going to have within the building, people running into each other in stairways and things like that. So there's definitely going to be some need to keep the density in buildings lower than what we would normally use. And it's going to be building specific. Some buildings are easier to have lots of people in than others. So, okay, let's see. Another question. And you know what, Kelly or Mark, if either of you guys want to start picking up questions and answer them too, so people don't have to listen to me all the time, that'd be good. I've got one here from Pat Boas. How do you determine where the research or graduate art students fit in with these levels and phases? I consider the graduate students and faculty that work in the creative arts, I don't see them conceptually any different than a lab in the science department. You guys have very specific studio needs that you have, so I would imagine that every time I say research, I also mean research and creative works, because those studios are critical to your work. But again, it's really going to, density of people and that can work is going to be depending on the way that the space is arranged and how many people can be in a space at a given time. Let's see. So there's been a couple of questions here. I think Teresa McCormick had one about the expected timeline to move from stage 2 to stage 5. And Mitch Cruzan has also asked in the questions, it would be helpful to establish a tentative timeline. I would imagine best case scenario, when the executive order, if it does expire on June 13th, that we will start this whole process of reopening on June 13th or somewhere thereabouts. And then some of this is, again, it depends on the county health department and what the pandemic looks like locally. But there's a minimum of 3 weeks between phase 1 opening of a county and movement to phase 2, which would allow us then to expand our operations a little bit more. So it's going to be, best case scenario, if we started off in the middle of June, we would move to even more operations in like the middle of July. And by September, we could theoretically be close to normal operations, but that's the happiest, sunniest forecast I could make. The reality is likely, I think, that we're going to be bouncing around in that level 2 limited areas and trying to work together to figure out how to maximize everybody's productivity and comfort with that all the way through the fall, would be my guess. But we're just going to have to work together and try to do the best we can, I think. Let's see. Alex Ruzica also asked a question about wondering about the concept of research priority and if it could be broadened. The guiding principles document is meant as sort of a starting point for us to think about how we're going to prioritize research. And we've laid out what we feel as an office and honestly what most of the research operations across the country think are the most important priorities. That being said, you guys are developing these plans at the unit level, and you can balance priorities at that level. It may be that some department doesn't have any of these issues to deal with, and so they'll have complete freedom to decide who gets to go back first or second or whatever. But so I hope that you guys don't take these guiding principles as super restrictive. They're meant to be guidelines, right? And there's obviously lots of room for people to make smart decisions around those guidelines. Wow. Okay, so there's lots of questions coming in now. I just saw one that confuses me, so I'm gonna go with that. Josh Jarodsky asked if we could elaborate why undergraduate research would be allowed before graduate student research. That's not what I'm saying at all. I'm saying the first people to come back are likely to be graduate students. One, they're the workforce for the research enterprise for the most part. And two, many of them are trying to make progress towards their degree. So graduate students will definitely come back before undergraduates, or they should, in my mind. All right, let's see here. Hey, Kelly, how about you do a couple of questions and I'll drink a drink of coffee here so I can wet my throat.
Yeah, absolutely. So there's a question from Eleanor, I don't know your last name, but talking about field-based research and could that resume if it can practice social distancing safely? So we've been thinking a lot about field-based research. So right now it is still must-sees, but whether you can resume that is going to depend again on what the mandate is from the governor and our local governments. But as we resume, the social distancing and hygiene requirements are definitely going to be taken into consideration, and perhaps even changes to your IRB. So at this time, no field-based research that involved human subjects could take place. And that might be slower to restart than, say, more biological sciences or environmental sciences. Jason, you have anything to add there? Anybody have anything to add there?
Yeah, I'll just add to that we do have some field operations that are ongoing right now, and most of them are in remote places. I believe Eleanor, it's probably Eleanor Gaines. Hi, Eleanor. Your project is ongoing. I know that. It's also in a very remote place in Oregon where social distancing can be easily maintained. So as far as field research goes, I do want to make a point. You know, we've said we're at level 3. We're at level 3, but remember when we shut down, level 3 didn't exist. So we basically shut down, and there were some people that were still doing research, and we haven't stopped that, and we don't intend to. So whatever's happening now, just keep doing what you're doing, and we will move forward with reopening some things. There have been other people who have done field work and have asked for exceptions, and those have been granted. I think the most difficult part of field work isn't the actual work out in the field, because it's pretty easy in most situations to maintain social distancing. It's actually getting to the field that is the biggest issue, because most of the time you carpool out there or something, and it's kind of feels wasteful to have everybody drive their own car. But you know, that's something that we have to think about. So we have some pretty good guidance on field research that will be coming out when we launch all of the tools that we have for you guys to use in considering reopening your research programs.
Lisa Bates has a question about human subjects review, human subjects research, and thinking about the IRB review timelines. Dawn, do you want to jump in and maybe comment on IRB?
Yes. Hi, everybody. Hope you're doing well. So the IRB timelines for review were the Research Integrity Office and the Human Research Protection Program are operating at normal levels. All the staff are working. So the same turnaround time that you've been expecting for while we were on campus are the same as they are now. I think that Kelly and Jason and others have described the human subjects research plan well. I think it follows the same. In order to conduct face-to-face studies, we'll have to follow the governor's guidelines, and there'll be similar plans as there would be for lab work or campus-based work in order to determine the safetiness of that. But the operations in terms of survey work or non-face-to-face work is continuing as usual. Does that answer the question?
I think she has an expanded question that's about doing face-to-face research, or, well, I don't know that it's face-to-face, but like talking about where people are coming to a site, like a food distribution center, could a survey be distributed there? So how we handle those kinds of things, whether or not it's face-to-face or not, I think is a big question for that kind of field-based work.
I think I can maybe help with this a little bit. We've been dealing, with any research that requires compliance review, like IRB or animal care. or biosafety, we've been dealing with it on a protocol by protocol level. So I think the most important thing is if you have a protocol for this work, to check in with the IRB and make sure that it can be done safely. The review would be done at that level, I believe, for this kind of stuff. For instance, you know, there are some studies where the participants are actually identified because they visit a clinic. Well, if they're going to that clinic of their own free will for medical treatment or whatever, and then they're handed an intake form by the doctor to be part of a study, that's fine, right? Because we're not out there making them risk their health to perform in our study. If it were you were going to go down to downtown Portland and set up a booth and ask people to come to you, or if you were going to go out to their neighborhoods, that's a little different story, and I think that's going to take some very careful review. It's not that it's impossible once we start to open things up again, but I think the human subjects part of this is probably the most difficult part for us to navigate. To give you an idea of what OHSU is doing, they're allowing in-person human subjects research starting during this phase 1 opening, but only in clinical situations where everybody is wearing PPE. They are not allowing any community-based in-person research activities until phase 2. So I think that, you know, in general, you should try to do remote work if you can. And for the other things, we're just going to have to wait until it's safe for us to be in larger groups. I want to, I just saw somebody said they wanted to re-ask a question. So I think Tammy Lassiter-Claire had asked a question and about basically saying that this looks like it's going to take a long time to draw up plans, review them, approving them, training, and all that sort of stuff. Yeah, it's going to take some time and effort, and I'm sorry for that, but I don't think there's any way around that. We have to be coordinated in our efforts here in order to keep the density in our buildings down. That being said, we're not asking for detailed page-long plans. The idea is that there'll be a spreadsheet that people can fill out with personnel that need access to spaces, a brief description of why they need to be there and how they were prioritized. And then, you know, we're going to have to sort those building by building to make sure that, you know, we're not putting 2,000 people into one building inadvertently or something like that. So we're going to try to make the bureaucracy part of this as light as possible, while still being able to collect the information we need to make sure that the densities that we're trying to establish are met. Yeah, there's lots. So John Perona asks, or basically pleads, I guess, that he hopes that we don't exclude entire labs while allowing other labs. So again, I want to say this, we're not excluding entire labs or allowing entire labs. You guys are working this out at the unit level. So if it turns out within the units or within the colleges, there's some reason that an entire lab gets left out, that's probably because of the priorities that were required in that department. And I think that, you know, those are going to be hard decisions, and they're going to require a lot of cooperation and community spirit as we go through this. So I don't think, you know, I don't think it's fair to say that we could say everybody can get somebody back in the lab, but there's definitely ways that you can use shift work or other ways of sharing spaces that would allow a larger number of people to start work while still keeping the density in the building low at any one time. And so we will be suggesting those as possible ways to work around that. And Dirk piled on to Tammy's questions about when will review of these unit plans begin. Well, as soon as we can get them designed and submitted up through the deans so that the deans have a chance to look at them. We need to do this all in the next couple of weeks, basically. So I don't think it'll take you guys very long to decide who you might want back in the lab and for what reason. And then it'll just be a matter of us trying to figure out how to best double check density of people in labs at various times.
There's a question here about research and teaching being treated separately in terms of like resuming those activities on campus. And so Lindsay Kissel is asking, if classes resume in the fall, how will that impact the ability of research to resume? And so while the committees are separate, there is some overlap. So I'm serving on that committee about restarting instructional activities. And again, I think these things are going to be dictated by the safety of everyone. So before we have a lot of students in the classroom, those conditions are going to need to be, the appropriate conditions are going to need to prevail. In terms of working out those priorities between teaching and research, I think that's a larger discussion. But again, it's going to be, safety is going to be paramount. John Fink had a question earlier that maybe Mark can answer, which is about how many graduate students are impacted by COVID in terms of their graduation, or PhD students. I don't know, Mark, if that's something that you could answer.
Yeah, I hadn't jumped in because the conversation was going in a slightly different direction, so I was just waiting. The answer to the question, John, is that I don't have a number off the top of my head. We have looked at the number of students that are likely to be impacted. This was part of an assessment for requests for additional funding from the federal government. I think it's fairly safe. Our underlying assumption was that pretty much all PhD students were going to be affected to some level, unless you had completely finished all experimental work and were only needing to do writing. It was almost inevitable that there was going to be some impact. There was no way of closing down research operations without having an impact. I think at this point I can just try to reiterate what we said earlier, that we're trying to, at the graduate school, we're trying to make sure that any policies that need adjustment to mitigate the impact are adjusted appropriately. So if there are policies that you come across that are contributing to problems, then you will need to let us in the graduate school know. Beyond that, I'm not sure that there's a lot more I can say, other than that it is affecting pretty much every student on campus. So for those who feel a great deal of stress about this, in fact, it's not just across our campus, it's across all campuses, pretty much across the country. So you're not alone in your frustrations. Everyone is suffering this. The best we can do is try and move forward and get people back to some level of operation.
Thanks, Mark. There's a bunch of questions about building density and who's going to determine that. And I think the best answer to that is that we're doing our best based on, the building densities will be dependent really on room size and configuration and how many people can be. If you draw an imaginary 6-foot or maybe 10-foot circle around yourself, that's the sort of social distancing that's going to be required. So we have to kind of figure that out building by building. IMT and facilities and environmental health and safety will be working on that, but we'll also again be working with dean's offices and others to make sure that we can balance the competing needs of different spaces and requirements and things like that. There's also been a question about ventilation. I think that's a great one. So that's one of the big differences in different buildings that we have on campus. For instance, the science buildings, at least SRTC, there's no recirculated air. So that's actually a pretty decent building to be in. And in fact, if we open the hood sashes while we're in the lab, as long as we're not standing right in front of the hood and breathing in all of this, the air that's being drawn towards it, that actually helps keep the air quality high. So, you know, we have suggestions that in the documents that'll be coming forward for, you know, opening the hood sash, which is while you're in a room, if it has a hood. That's not normally something we would suggest to do because it wastes energy. But in this case, that would be a good example of how to increase ventilation. And we actually have Dean Rich Corsi in engineering is an indoor air quality expert, and he is advising us on air quality, and we're looking at ways to like increase outdoor air supply to the buildings during this time as well. I do want to answer one question from Brooke Napier about OHSU and the RLSB. So she basically says that for those people sharing space with OHSU, is there communication with OHSU about shared spaces? And it seems like during the shutdown, there was mismatched expectations between PSU and OHSU personnel. So Brooke, I'd like to talk with you offline about what that mismatch might have been, but that's exactly why we adopted the research operation levels that we have that are exactly the same as OHSU's to try and prevent as much mismatch as possible. I know that starting this week, OHSU is actually allowing one lab per department to do a soft restart with just 1 or 2 people. I should note that OHSU is not under the same executive order that we are. That executive order on higher education doesn't apply to OHSU. So they've actually, as a good example of an institution that shut down their research operations, they actually weren't forced to by the governor. They did out of their concern and caution for public health, and also to make sure that their hospital was operating appropriately and had the right resources. So you may hear from OHSU that they're doing a soft restart starting this week, but that's only one lab, and I don't know how they did this, but somehow the director or chair of each of those departments chose a single lab to start up again. I don't think that's a good idea for us here at PSU. I think it's better for us to all think about this and move forward as a group than to, you know, pick one person and let them start. So, okay, there was another question or a comment. I think this one was from Dean Atkinson about spreadsheets. Yes, so please don't go and start making your own spreadsheets. We have a spreadsheet in mind. It has all of the information that we feel like we need in it to help you get organized and define the spaces that you need available to you, but also to help us to be able to sort by building and other things. So we will be rolling that out next week for people to use as they start to develop their plans. So please don't go and reinvent the wheel. There's no need for that. And we're going to need one common spreadsheet that we can collate from across campus at some point anyway.
Jay Nadeau has a question about a field-based project with 5 different university collaborators from different states with different levels of shutdown. It would be great if we could coordinate efforts with other schools. Lucky you, Jay. That sounds like fun. So I just want to reiterate something Jason said in the beginning. Like, a lot of these documents that we've developed have been in concert with the Association of Public and Land Grant Universities. There's been a lot of sharing across universities across the country. But I do think that, you know, if we're at one level and another state or another location, there's some dissonance there, you know, we are not going, you know, you're going to have to operate by the rules and the guidelines that are happening in those locations. So we're here to help and to the extent that we can in that coordination, but I don't think we're going to see the entire country in sync on this because the pandemic's definitely going to be uneven.
Slowing down in the chat, although you guys might want to go back up because for a while there, they were really pouring in. I'm going to go back to the ones that were submitted. Let's see. There's a question from Kyla Zaret that basically says research that is fully remote, quote, they're quoting something from one of the documents. Research that is, quote, fully remote, requiring infrequent or no access to university spaces, unquote, can be undertaken without approval by RGS as a question. I think the answer to that is yes, as long as it's research that doesn't involve compliance issues that you would need okay from. We clearly don't want to stop people from working. So if you can do what you need to do remotely, please do it. There's no need for us to be worried about that. It would only be in the case that research was research that needed some sort of a compliance approval before it started. In the same question, it was a question about field research. And I think we've already covered that in many of these ways. So let's see. Carolyn Quam has asked a question about, says, my main question is regarding research in educational settings, preschools, kindergartens, and whether or not we'll be allowed back into those settings. So that will be dictated, I would guess, by the schools and not by us. Based on the way that they shut down the state, the first thing to shut down were the K through 12 schools, and then higher education went next. So it's very likely that we'll be open for business before our K through 12 schools will be open for business. So I think we'll probably be aligned there. If not, we'll definitely make sure that we figure out a way to have that conversation. But I just can't see us being closed and them being open. That doesn't make much sense, I don't think. At least I hope not.
Karen Vanek asks a very good question about not just coordination across different units on campus, but we also share some spaces with the city of Portland and other entities. And so particularly 4th Avenue building and the engineering building share space with the city of Portland. And so we will definitely need to have some communication and coordination with them about restarting, because that's not necessarily a research function, but that's definitely something that the university is going to have to coordinate. And I do know that when we shut down, things were happening very quickly there. So all these activities are going to have to require a great deal of coordination, especially across these shared spaces.
Okay, next question is, without a vaccine in place, I'm extremely concerned about the idea of reopening on-campus classes. In the case of such an event, will faculty and students be allowed to choose whether to teach and learn remotely? So this is a teaching and instruction question, which again, this will be addressed better by Provost Jefford's group, but it still applies to this. And I just want to answer it by saying nobody should be forced to come back to work. I think we have to be really sensitive and responsive to people's comfort levels with being out in public right now. Many people have children that they care for. Many people have elderly or other immune compromised people that they care for, and they don't want to risk it. And we shouldn't force them to. So I think that, we need to apply that principle across the board, no matter what we're doing during this time. Daryl Grant has a question about creative activities. There's no specific mention of creative activities in the phased approach to resuming research. At which phases are funded or unfunded creative activities to be resumed? I apologize for that. I try as much as I can to make sure that I include the creative activities in our documents, because like I said before, studio spaces are really no different than lab spaces. I don't know the answer to that, and I do know that we plan to reach out to Dean Bynum and talk with him about how to best coordinate this and think about where they should fit in on that schedule. But that being said, we should be getting people into those spaces during the phase 1 reopening, because again, it's not about the specific activity that we're doing on campus for the most part. It's about space concerns and whether or not the person can be in that space safely. So, And I do want to mention, there was a comment by Ken Stedman up here about it's more important, it may be more important for how long somebody's been in an enclosed space versus chance meetings in a hallway or something like that. So there are some plans that I've seen out there where they require an hour or two of unoccupied space in between occupation of a room. So if somebody shares a studio with somebody else, we might, or even in a lab, we might say somebody can work from 8 to 11, and then nobody works from 11 to 12 or something like that. And then somebody can work from 12 to 3. So we might try to stagger some things. We're still trying to get good guidance on this. So Ken, if you have good guidance on this, that would be good. It'll be based on the turnover rate of air in the room and all sorts of other things. We also, of course, are going to have disinfection protocols so that when you come in, you're going to probably have to wipe everything down, touch surfaces and whatnot. And then when you leave, you'll probably do the same thing. Let's see. There's a question from Scott Jacqua, and he's asking, will facilities be increasing their presence on campus as part of the resumption of research activities? The answer to that is yes, they have to, right? That's one of the big issues that we have with returning to campus. Remember that most of the facilities personnel are not on campus right now. And we need them back before we come back to get all of the systems online and make sure everything's good and in good working order. EH&S will have to come back before faculty come back to go through labs and check safety and all those sorts of things. So I think that we will expect increased footprint of facilities on campus, but we're going to have to, that's one of the things we're going to have to balance as we start back up is they have to be able to do their work safely too. So we have to have reduced density of those people on campus. They're going to have to do shift work. And so that's one of the things that's going to limit our ability to have full density on campus during the initial phases.
There's a question about art students being able to borrow specific tools to do work at home, and can they get support to develop a safe process for checking out that equipment? I know that the library and other places on campus were doing that early on, and I think that's something that environmental safety and health and can probably help with that process. So yes, I think the answer is yes.
Okay, I see there's been a couple of questions about parking, and this is a really important one. There's two related questions that we've gotten in a number of different places about either parking or using public transportation to get to work. There's a lot of concern about that. I guess probably with good reason. It's hard to have good social distancing on a bus. I'm a regular bus rider, so I can definitely understand that. Right now, parking is free, and as long as you're a university employee, and so you can apply to get a little permit to put in your window. That will, as far as I know, the plans are for that to continue. And so especially during the initial phases, I think driving into work will be a possibility for people so that they don't have to risk public transportation if they don't want to. That might change at some point, especially as more and more people start coming back to campus. So we definitely don't have enough parking for everyone. So we're going to have to play that by ear. But at first, at least, parking should be paid for or free, basically. And you just have to apply to get the permit. So.
Mark Peasley is asking about contingency plans in the event of a second wave of the virus. Will we have criteria in place for determining when and if another shutdown is required? So I think in all of our scramble to implement these procedures for shutting down campus, we do have that in place now. And of course, that's not going to be entirely dictated by us. It's going to be dictated in part by what the mandates are from government. But I think given if there is a second wave, we'll have a lot more procedures and tools in place to shut down activities.
I had another question from Todd Rosensteel about advising PAs on how to think about hiring their summer GAs. So this is, I think, one of the reasons why I put high priority to early career stage researchers, because graduate students are certainly some of our most vulnerable populations. They make very little money. They greatly depend on our support. And I think that, you know, I was heartened during the spring that we basically had everybody that was planning to be supported on research assistantships continued on that. And that's one of the main reasons why I worry every day that we need to get research restarted for the summer, is to make sure that those students have that support. So I would encourage PIs to do everything they can to work towards getting those graduate assistants signed up for research projects over the summer. And we'll do everything we can to try and help make sure that they can get some work done, as long as it can be done safely.
Jane Ado had a comment about incoming graduate students. Also, please comment on incoming graduates. Can they start this summer? I think the answer to whether they can start this summer is simply governed by how much research we're able to do. In terms of the incoming graduate student cohorts, this was discussed amongst the doctoral program directors. If anyone is associated with a master's program and is concerned about this, please feel free to reach out and contact me. There were a number of ideas that came up. In terms of international students, if the university goes fully remote in fall for instruction, there's going to be a problem in terms of getting visas. There may be problems for international students in getting visas. Not all embassies are issuing visas to international students. And so I think it's very important, and I think this idea originally came from Todd Rosensteel, to reach out and maybe have Zoom meetings with incoming cohorts to appraise them of the situation, make sure they understand that you're still interested in seeing them show up, to discuss within your programs about how you're going to be flexible in terms of getting students to show up. In addition to international students having travel problems, some domestic students may have longer distances that they need to travel to get to campus. There may be activities that you have planned that involve groups that are larger than the governor's executive order allows at the moment. And so obviously we don't know what the situation is going to be for late September, early October, but I think it will be a good time now to begin planning for how you might be flexible and what you might do if you're unable to do the kinds of activities that you normally do. It's going to be a challenge for all programs all across the country. I think that maybe the most important step you can take right now is reaching out, maybe having a conference Zoom meeting with the incoming cohort and try to build up some camaraderie before fall comes around.
Thanks, Mark. There's been a question about testing. So as you can imagine, there's a lot of interest in testing, and adequate testing is going to be one of the availability of adequate testing is going to be one of the things that Multnomah County Health Department has to have in place before we can go to the phase 1 opening. You've probably read in the news or heard from colleagues that some universities across the country are actually standing up testing themselves. And for instance, U of O worked in collaboration with McKinsey-Willamette Hospital in Eugene to boost their testing facility, but they are working in coordination with their county health authority. And we need to work in coordination with Multnomah County Health Authority. And the reason for that is that one, there are multiple different tests out there. Many of the antibody tests remain unreliable, and there's still a lot of question about whether or not they're actually useful at this point. The RNA-based tests, which can tell you if you are infected or have recently been infected, are also unreliable. And I don't know if, Ken Stedman if he's still on the line, he could unmute himself and talk about this a little bit. But, the usefulness of testing for us is probably pretty minimal because the incident rate in Oregon is so low in general. Where it's going to be important is when somebody does get sick or if somebody does test positive, we're going to need contact tracing. And that's going to be the most important part of our ability to help control this as we reopen. And that's one of the reasons why we want to know where everybody's going to be and at what time. Well, maybe not exactly what time they're going to be there, but we need to know who is expected to be in buildings on a given day so that we can let them know if somebody was tested positive or something like that. So Ken, are you on? Yeah, I see his picture, but oh, there he is. Oh, you're muted.
Oh, I muted myself?
Yeah. So did I say anything wrong?
You're pretty close. I would disagree with you on the RNA test. The RNA test is actually really good, but at the same time, I think we have to be very careful about what we decide to do with it. The main issue actually with the RNA test is that it will detect RNA even if there's not an active virus infection. But you're exactly right that we've got such a low level in Oregon right now that any positive, and this is particularly an issue with the antibody tests, is quite possibly going to be a false positive. And I think that basically the only way to do something reasonable about testing is actually what the state just set up through the PSU, OHSU COVID Council, which is a statistical testing all the way across the entire state, and trying to have surveillance, but it's not surveillance on individuals coming into or out of an individual building. It's going to be on a population level to try and pick up whatever kinds of outbreaks are happening. And so this may end up being a survey of sewage, which actually is a pretty good way to detect viral RNA, and then localize things. But in terms of individual tests, people coming into and out of buildings, at this point, it really does not make sense. It's a real waste of resources to be testing everyone. And the great little IR thermometers are great and wonderful, except for the fact that maybe 60% of cases actually have a fever, and a lot of the transmission seems to take place before people have any noticeable symptoms. So I think that in general, testing, again, before coming into the building or anything on a daily basis is, I think, going to be really counterproductive.
And super expensive. So we're talking millions of dollars going into producing testing facilities that could handle testing at the level that we would need to do it at as well, if we were actually going to test people and make it useful. That's my understanding anyway.
I just talked to a guy from a company on the coast. They tested 186 people. It cost them $30,000. Yeah.
So I think return on investment there might be a little low. So, okay. Thank you, Ken. I appreciate that. Here's some more questions. There's a question from Risto Rushford. Are research-focused student groups considered in phased approach to resume research? I think, again, in these first phases where we start reopening campus, I would think student groups would be low on the priority list, given the potential risks. But I think that there's, as with all of these things, there's room for discussion with your chair and your dean. I think that if we had to choose between a student group doing some research, like our rocket group or something like that, versus letting somebody do collect data on an NSF grant or let somebody finish their thesis work, I'd probably prioritize those as more urgent in the short term. There's a question from Elise Granick on, will undergraduate researchers be allowed to conduct research this summer, maybe working in pairs with graduate students? I think, you know, this is a fieldwork question again, and that's probably going to be something that's okay to do. I think, again, as long as people are really asking themselves what the benefit and risks are for their students, for those undergraduates, and making sure that they have a way to assess whether that student is truly volunteering to do that work and can do it safely, or whether or not they're feeling pressured to do the work. I think that, you know, that's not out of the question. I think we need to be very careful, though, as we work through these situations, to make sure that safety is the #1 priority. There's another question from Eileen Brennan. It says, how will PSU handle acceptances of grants that may require contact in order to fulfill research plans presented in proposals? In some cases, the projects may involve collaboration with organizations in different states that have different plans for opening. How will we handle that? Again, these sorts of things I think are best handled on a project by project basis. And it's really going to depend on the nature of the work for that particular research project, and how it is the mode of interaction with people and other things. So we're going to have to be flexible on that, I think, all of us. But if you run into that situation, the one possibility is to say we're going to accept the award or ask for a delay in start of the award for some amount of time. That's usually not a problem if it's a federal agency. Dawn, if I'm misspeaking, let me know. Chime in here. So you could, you know, one option would be to delay start. The other option would be to modify your methods or something like that. But that would be the best way, I think, to approach that one. I think Jen Morse asked the question. It's probably already been answered, but I'm going to answer it again because I want it to be super clear. Her question is, will decisions about managing priorities for research in labs be left to PIs, or will the administration need to approve each lab's plans and activities? I'm not confident RGS has the bandwidth to administer that kind of oversight efficiently without additional new staff. I 100% wholeheartedly agree with you with that. I do not want to have our staff having to review every plan, which is why I think that the units need to develop those plans, and our goal is really just to make sure that the densities in buildings and the types of work that are going on can all be done safely. So no, we're not. I mean, we have the ability, and I think it's important for us to be able to deny work if for some reason it's super risky, but I can't see most of the stuff that we do as ever falling into that category. Like, I can give you an eventuality when I say that. So there may be people doing work with radioactivity. Well, we have to have a radiation safety officer. Scott's probably on this call somewhere. So if Scott gets sick and goes home, and you need to order more radioactive materials, you're not going to probably be able to do that because Scott's our one radiation safety officer. And we sort of just need to know about that kind of work and the various touch points that it might have across campus. And so, you know, situations like that might limit our ability to work during these times.
Sarah Grant has a question that I think was already addressed about how creative activities are going to be handled in the phases, and I assume you mean operation levels of research activities. So our intention was to treat those explicitly in those operation levels, and so we talk about studio work, but I understand that if you feel like your work isn't properly represented, or there are questions about the kinds of activities or needs or equipment or something that we haven't considered that speaks to you, please reach out and contact us, and we can try to address those concerns in these research levels. So our intention was not to leave you out, quite the opposite.
Okay, here's a question about PPE. So Greg Beatty asks, given the apparent shortage of PPE available, how will the university be able to provide PPE for faculty, staffs, research labs? So one of the first things that you're going to need to do is reorder PPE. If you're like me, you may have donated a lot of it to first responders. So, you know, one of the first things we're going to need to do is get the chemistry stock room and alert shipping and receiving that orders are going to be coming in again. And we should start ordering the PPE. We will be probably requiring people to wear masks when they're in public spaces. If we do that, we will be providing those masks. This question also has what checks and balances will be in place to make sure people are following the safety practices. So I think this is, I think we're going to have to police ourselves as a community. I don't think any one office or entity on campus should be the enforcer here. I think as we police ourselves during normal operations on what's safe and what's not safe, we're all going to have to work together as a community. And I think it should be completely appropriate if somebody sees somebody not following the rules to say, hey, you know, follow the rules, come on, be a good team player. That being said, I believe facilities is doing audits on card swipes to get into buildings. And the buildings will probably remain locked down for some time now. So, you know, we'll know who's coming in and out of buildings and know if people are following their general plans, but nobody has time to monitor things at that level. And somebody asks if there's a shortages of masks that they hope work isn't delayed if they can provide their own. Of course, if you want to provide your own, I mean, I have designer masks that have fish on them, and I would prefer to wear those, and I will. You know, I think the idea here is that if we're going to require you to wear them, we need to provide them. But you're welcome to wear your own for sure. There's a question here about tuition remissions and tuition discounts. I don't think we can really answer that here. There's a good FAQ question or FAQ document about the COVID response on the PSU website. There are hardship funds available. Students can request those. The CARES Act money that's available to our students to help defray the costs of this pandemic on them. It's my understanding that it's like $8 million or something that goes to student support. That's not for tuition, that's for non-tuition costs. And then there are other hardship funds that can be used for tuition, but that's going to be best handled by submitting a question to the IMT, to that COVID questions at pdx.edu. I don't know if somebody can find that email. That would be great if you could post it in the chat. Tammy Lassiter-Clare has asked another question. She asks, will graduate students supported on RA have priority access over those on TA? I actually don't, I don't know that there's any priority at least not in my mind, between these two activities. They're just activities that need to be balanced. Some TAs, you know, if we're still teaching remotely, some teaching assistants are still coming in to use university resources to support their teaching activities. Some professors are doing the same. And I think that would just have to be part of the equation. Of course, you know, if you are a TA for a class, you have to do that work, right? So they're going to have to be allowed to access to whatever resources that they need within the building. Hopefully those resources wouldn't overlap with where an RA might be. So they're probably going to need to be in different rooms. That's another thing I was just thinking about that we should probably mention is that I think we're going to advocate for having lounges, kitchens, and other shared spaces remaining unoccupied and unused at this point in time, just to try to limit the number of places where everybody is going to go and potentially gather or potentially leave traces of their infection if they happen to be infected. So something to think about. Let's see, are we running out of questions in the chat?
I think Ken Stedman asked the question about volunteer researchers, high schoolers, in allowing them to do research if it can be done in a safe way. My guess is that that's not going to be the first priority. So in our thinking about resuming activity, just because of the risks. So if we're putting undergraduate students' safety and health first, of course, we want to think about the larger members of our community as well.
Yeah, and I think one thing that I often think about with undergraduates and especially high school students is that you know, we're going to be operating under conditions with lower density, so there's going to be fewer people around. That means there may not be somebody there if they do something, hurt themselves or whatever. And so I think for their own safety, they really should always be supervised anyway. And so we have to think about how that supervision could occur in a laboratory situation like this. Now, it's possible that they could come in and use a laptop to Zoom you in, and you could be there virtually to help them out. But I think that's probably less than optimal. That might work really great for a graduate student, but might be a little risky, I think, for anyone with less experience than that. So I would suggest extreme caution, especially with high school students, but undergrads as well.
I think it may also be worth following on from what Jason said, that given the low density of researchers in the building and in labs, it isn't going to limit to a certain extent what can be done safely. In chemistry, the general recommendation, or I mean, we would like it to be an instruction, but it's not always possible, is not to work alone in the lab. That might be something that people are needing to do more. And if you're going to be working alone in the lab, there are certainly some operations that you simply shouldn't be considering undertaking. So some things, even though we're able to go back to, once we get back into the lab, when we're under modified working conditions, not everything that we want to do will be possible to do simply because it isn't safe, because the lower researcher density means that it isn't safe to conduct. There was a question from iPhone 3 about, just following up, I think, on something I mentioned, who are we able to reach out for support for, sorry, let me start again. Who are we able to reach out to for support with regards to international students? And David Brandt posted in the chat, International Student and Scholar Services, International Office, International Affairs, oia@pdx.edu. So if anyone didn't notice that, that's a support for the international students.
Thanks, Mark. There's been a question Ethan Sperry asked, and I'm sorry if we missed it earlier. The question is, are units allowed to request space from other units to address these concerns? For instance, art practices will likely need to be in larger spaces. I think we would leave those sort of space decisions up to units or colleges. I think it's unlikely. I mean, it's possible maybe that depending on the type of activity that empty classrooms could be used for these sorts of things. But I don't think RGS is going to be dealing with that level of management. I will ask the question though, and make sure that I talk with Dean Bynum about this to see what his thoughts are on that. It's not gonna, I mean, again, because we're coming back to campus at a lower density, it's not like there's a lot of free space other than our classrooms that are empty right now. So that's really the only other space I can think of that might be flexible. All the other spaces are likely to be used at some density by the units that normally occupy them. So thanks for that question. There's a question about if renovating SB1 is on hold. Todd Rosensteel is on this call. I see that. Todd, do you want to chime in on that?
Yeah, sure. No, I mean, it's not. We're still going forward with planning. I'm meeting with government relations to map out a different legislative strategy. So for the moment, until we hear differently about capital investments in Oregon, that work has continued. It was stalled because of COVID, but we're picking it back up. So.
We're getting close to the end here. You guys have been troopers having to listen to me for this long. If there are no more questions, or it looks like they're starting to slow down a little bit, I might make some concluding remarks here and then we can close down. So basically, the next step here is we're going to be reaching out to the deans and the department chairs first. We're going to get the materials that we've designed to help with this process to them. They will get it then out to the individual faculty to help to start that process. Look for those resources next week. Please remember that our timeline is linked to the COVID-19 pandemic situation in Multnomah County. So it may be frustrating to you if you hear that your colleagues at U of O or OSU are moving forward and we're not, but that's because we're tied to our population center here. We're aiming for mid-June. It could happen sooner than that, maybe a little later, but let's just keep our fingers crossed for that. And remember that once we start reopening, it's 21 days of whatever we start before we can relax those restrictions farther. So that gives you some idea of how to plan for the summer. So look for more guidance soon. And if we didn't answer your questions today, I'm sorry, they were like flowing in like crazy. And we have all the questions in the chat recorded. We have all the questions that were submitted beforehand recorded. We will post answers to those on the web sometime in the following week so that everyone can have access to those later on. So Kelly or Mark or anyone else have any closing remarks?
Just that I appreciate everyone's time. Your questions are great, and it also helps us think about how to move forward. So thank you.
Yeah, yes, thank you all for your time. If there are things that the graduate school hasn't considered, as I say, please let us know and just stay safe.
They're going to look into well
Whoa, people are unmuting. Anyway, I guess that means pandemonium is setting and it's time to go. Stay safe out there, everyone. Take care, and thanks for all your hard work.